Man is the only creature God created that's a biped. All other creatures crawl or walk on all fours. But because of that, 90% of the people develop chronic back pain in their lifetime.
In a textbook normal spinal column, spongy discs hold each of your vertebrae apart. Over time, and for various reasons, a disc can degenerate, causing the nucleus of the disc to bulge outwards, sometimes pinching a nerve. As degeneration continues, the bones spur outward with sharp edges, causing even more discomfort. In addition, the weight shifts from the center of the disc to the joint facets in the back of the spine. These are very pain sensitive. Towards the final phase of this painful downward cycle, the disc is almost completely deteriorated. Surgery is not the only option. Strengthening and rebuilding is what you need. Dr. Alan Unruh's newest technique can help your back heal and feel better. The A. Unruh Chiropractic Center is one of the unique clinics that is dedicated to the highest quality of care, utilizing the latest in technology, such as the Cox Distraction table. This allows Dr. Unruh to treat the most complicated disc and spine injuries effectively, avoiding most spine surgeries and/or repeat surgeries. People with previous back surgeries don't have to learn to live with it. Dr. Unruh has seen patients who have had up to 7 previous back surgeries and multiple spinal fusions. The gentle distraction procedures are very safe, and Dr. Unruh has a good working relationship with other medical professionals to give the best care to his patients.
And back and neck injuries in the spine and pelvis are a major cause of concern. Other than the common cold, it's the #1 reason people go to a doctor. And so how do we correct spinal problems before they develop into major problems? Back surgery 95% of the time could be prevented had people paid attention to their spine and taken the proper care at the time they injured it. So our clinic is always dedicated to some of the latest technology and manipulation. We have a special instrument we've invested in to help prevent back surgery and also help people who've had failed back surgery and help relieve these conditions and help them improve their whole life. Because if your spine is in line, you'll feel fine. If you have back problems, it affects how you sit, you walk, everything in life is affected because nerves control everything. There's 4,600 miles of nerves from the brain through the spinal cord. They all exit between each vertebra, 300,000 nerves between each vertebra in the spine, 3 million nerve impulses come out of the brain every second. And they fire 300 miles an hour, controlling the function of all the muscles and all the organs, according to Gray's Anatomy. So the spine and pelvis are pretty important. And neglecting the spine can have long-term effects on many human ailments. With this instrument, the distraction instrument, we can do a unique approach to health that's very gentle, very safe to a patient. I stabilize the ankles when I put a patient on this machine so they can't kick me that way. And when I contact the cervical spine and I push a button, the table gets longer. And I can just basically test the patient to see if they have any pain in any part of the spine when we stretch the spine using the distraction instrument. It usually feels very comfortable to a patient. If they do feel pain here or here, we can pretty much isolate where their major problem is. As I move down the spine with my hand, I'm releasing pressure inside the disc below my hand. The disc is like a sponge between the vertebrae. It allows for movement and also acts like a shock absorber. We'd be a foot shorter if you didn't have discs. There's that much cushion between each bone. So as I stretch the vertebra apart, we're gently releasing the tension in the muscle, which also releases lactic acid, substance P, histamine, hydrogen ions, chemicals that kind of glue the muscle fibers together. Inflammation to the body is like rust is to the pipe. It's very corrosive to muscles and joints. So as I move down the spine, you feel a little more tension as I move down, and we can isolate where the pain. We get a little bit of reflex spasm where we can feel the tightness and fixation of the vertebra. Also, I can lower the control here and move sideways and release pressure inside the joint capsule. The joint capsule is where the bones glide on top of each other. So we're doing lubricating the joint capsule. I say we're like Valvoline. You're getting a lube job at the same time. So we always ask the patient, do you feel any discomfort at all when we start to move sideways? Now, if it relieves the pain dramatically as I move sideways, I can combine that with axial distraction. If I move to this side and it causes more pain, I can pretty much diagnose how the nerve is being compressed. It's what they call a lateral disc that's bulging more to one side than the other. So the objective is to pull the disc away from where it's pressing the nerve. And we gently release the tension in the muscle and pull the disc back to its normal position. We can also loosen the control here that allows for me to give flexion distraction. So I'm combining 3 different types of decompression. I'm doing axial distraction straight out. I'm combining lateral flexion and also flexion distraction to realign the disc. So it's very sophisticated technology, very gentle to the patient. It feels comfortable. Patients say, this feels great. If they have a very acute pain, we basically modify the treatment to the patient, not the patient to the treatment. So it helps in not only diagnosing how the nerve is being compressed in the spine, but it's a very gentle treatment to realign the spine. Then as we move up the spine, I can also have a control here where the cervical spine, I'm controlling, basically stretching the neck region and contacting the suboccipital region. We ask the patient, do you feel any pain? They say no. Or if they do, I've had people had severe pain, even just very gentle distraction. And these are people that have given up by neurosurgeons, orthopedic surgeons. They wanted to have major complicated surgeries. But with regular care using this approach, we've been able to help these types of patients. Then we move sideways. I ask if they feel any pain going this direction or this direction. We can also rotate the cervical spine while we're distracting the spine. So I can move the spine in many different positions, feeling the tension in the muscle, feeling where vertebrae are kind of locked together, not moving properly. And then if they've got a chronic problem causing pain in the upper back, into the shoulders, or down the arm, we can also stabilize the cervical spine. And we always ask the patient if they're claustrophobic in any way, that when we stabilize the cervical spine, I contact the tension in the muscle and gently stretch away. And what this does, it releases the tension that builds up in the cervical region and in the upper thoracic region. It's kind of like when you was a kid and hung on a clothesline wire, it sags afterwards. I'm taking the slack out of the muscle and then gently stretching, very gently stretching. And it feels so good to the patient as we work the tension out of the muscle with this instrument. I'm controlling how much resistance we're giving. I can feel the muscles. If they go into any reflex spasm, we're gently releasing all that tension, and you can actually feel the vertebra release. Did you feel that? And you can just feel it, the tension release from the muscle. So it doesn't take long, but this approach is very gentle to the patient, and it feels very comfortable and helps some of the worst spinal chronic pain patients recover from injuries. So ask about the Cox Distraction instrument when you call our office and how it may help you, whether you've had chronic back pain, failed back surgery. There isn't hardly any spinal condition we can't diagnose and treat with this special instrument.